Thank you for joining this COVID-19 community update with a focus on Santa Barbara County and the Delta variant. My name is Dr. Lynn Fitzgibbons, and I'm an infectious disease physician.
My name is Carolina Arias, and I'm Professor of Virology at UCSB.
And Professor Arias and I have worked together closely over the past several months with a focus on the variant of SARS-CoV-2 virus in Santa Barbara County, and so have prepared this community update together. Professor Arias has given a very elegant presentation of this same slide set in Spanish, which is also available via a related link. So as we think about the coronavirus, the SARS-CoV-2 virus, which is really over the COVID-19 pandemic, caused a tremendous amount of disease and of course death, we have to remember that the virus has been constantly changing. Some of these changes have been small or minor mutations in the genome that encodes the virus, but frequently new patterns creating a new variant have evolved. This evolution has continued throughout the pandemic. Early in 2020, much of the world, including our own community, were struggling to simply have enough testing to determine who had COVID-19 disease. And the great news is that since really the middle of last year, testing has become much more easily available throughout the US and in many other parts of the world. When we think about variants, though, it's important to remember that the tests that we use in our clinics, our hospitals, and other testing locations simply look for the virus itself and not for specific variants. Variant testing requires very specific techniques, usually genomic sequencing, which is done in sophisticated labs and takes many days or weeks to result. For this reason, patients very rarely know which variant of the virus they had, and it rarely changes the individual patient level recommendations for treatment and isolation. Variant testing, though, we've learned time and again this year, is critically important for public health reasons. It's important for our community, our public health officials, our clinicians to benefit from knowing what variants are circulating and prepare for surges that may be on the horizon. There are very specific features of new and evolving variants which are being studied closely, including whether a variant is more infectious, may cause more severe disease, or perhaps the most important feature that we are following currently, whether a variant brings with it the possibility of immune escape. In other words, whether the new variant can cause disease in some or many of the people who are vaccinated or have previously been infected. The CDC is one of several national and international public health agencies which have been following this data on various variants very closely and have categorized them as either primary variants of concern or variants of interest. There have been some recent additions and actually removals to the CDC variant of concern list, and the current list is summarized here. In addition to the pangolineage scientific name, most of us are now familiar with a new naming convention introduced by the WHO using the Greek alphabet, Greek letters, to both simplify the naming convention, but also to avoid misunderstandings and potential biases from ongoing reference to countries of origin for some of these variants of concern. In Santa Barbara County, the most common variants during our winter surge were the West Coast variants, which recently were actually taken off the variant of concern list. Of course, in our own community, we do unfortunately have at least 2 or 3 of these variants of concern still circulating. The Delta variant was first identified back in India in late 2020. And it's now clearly known to have been the dominant variant in the devastating surge that occurred in India and is still ongoing in India, but really peaked in April and May of this year. We've also learned in recent weeks that the Delta virus, the Delta variant, has rapidly replaced other variants around the world and is now the most common cause of COVID-19 globally and here in the US. And here we see the CDC data presented earlier this week, showing that now over 50% of COVID-19 cases in the United States are due to the Delta variant. Why? And so we need to think about the clinical features or what we know about the Delta variant. We know that the Delta variant is the most infectious variant that we have seen yet in the COVID-19 pandemic. Whether the Delta variant causes more severe disease or less severe disease is still being looked at. And it's important to remember that some of the measures that we followed during earlier stages of the pandemic to gauge the severity of disease are hard to directly compare to what's happening now. For example, if we were to look at the number or percentage of people admitted to the hospital with a certain variant circulating to gauge severity of disease, or whether a particularly prevalent variant infection is subtly different than other variants, it's very difficult to compare the data now, even in our own community, to data from 9 months ago or 12 months ago. The situation, the landscape regarding vaccines, regarding natural protection, and several other very difficult to measure metrics are simply too difficult. For now, what we do know is there certainly are not huge differences in the severity of disease that the Delta variant brings. We also know that the current vaccines in the United States are providing very good protection against severe disease and against hospitalizations. And we're hearing reports of the same from around the world, including some very reassuring data from Public Health England, who are now several weeks into their own experience with a big Delta surge, and yet are not seeing big strains on their hospitalizations and their healthcare systems. Most cases, of course, of severe COVID-19 due to the Delta variant that are requiring hospitalizations are now happening in unvaccinated and immunocompromised people. Data again from the CDC earlier this week shows us the Delta prevalence in the United States by region. It's important to remember that not every region is doing sequencing as commonly or as frequently as other regions. Here in California, our sequencing efforts back in the winter and early spring were quite low volume, but now they've picked up substantially. There are certainly regions across the middle of the United States and elsewhere where the number of sequences that are available are quite small, making this data a little bit difficult to interpret. But still, I think the trends are important to note. And here in California, Nevada, we have approximately, according to the latest CDC data, 57.1% of all COVID-19 cases are due to the Delta variant. There are many studies being talked about and reported on, available for us to review, that look at this critically important question, perhaps the most important question of the moment. How effective are the vaccines, or vaccine efficacy? And while each of these studies has slightly different results, the trend has been overwhelmingly similar for the Delta variant. People who are fully vaccinated in this lowest orange curve continue to show excellent protection against severe disease and against infection as a whole. We now have information on all 3 vaccines available in the United States to help us confirm this. Again, some of this data is in real life epidemiology, patient results. Much of it, though, is based on what's called neutralization antibody testing, where you take the antibodies from someone who's been unvaccinated, partially vaccinated, or fully vaccinated, and you see how well that person's blood or their antibodies that are in that blood perform against the Delta variant and other variants. Time and again, the South African associated variant, B.1.351, continues to perform quite poorly against several of our current vaccines. But the good news is we don't have that variant circulating in our community. The variants, of course, that we have circulating in our community include the Delta variant, include the Alpha variant, the B.1.1.7 from the UK, and P.1, the Gamma variant, first recognized in Brazil. And again, people who are fully vaccinated are continuing to demonstrate great protection against these variants. I think this reminds us just how very important vaccines are in protecting not just ourselves, but our whole community. And so what is the current condition of our community? In an effort to inform our local clinicians, our community, our public health department Professor Arias and I undertook a local variant research project earlier this year, which included sequencing of approximately 400 local samples over a 6-month period to understand the variant trends. We're not going to go through the details of that research effort. It's available on the community dashboard. But what I think we learned was perhaps the most important thing to remember through this summer. We were able to confirm that our local trends really moved in line with the region, including the timing of the appearance or the introduction of the Alpha variant from the UK. As it appeared throughout the state of California, so did it appear here in Santa Barbara. Its subsequent rise and then its fall in prevalence, again, we watched really mirror the state's experience. We also, before that, saw the impact of the West Coast variants as really the dominant variants during our very severe winter surge here in the Santa Barbara County community. And even when we look at very small numbers, like the appearance of the P1 or the Gamma variant in late March, early April in the Santa Barbara County area, we again started to see this variant in small numbers at that point, coincident with when it was being seen around the region and around the state. We should remember that Santa Barbara County has often trailed Los Angeles County by a few weeks. And we've heard from the Santa Barbara County Public Health Department last week and again this week that sequencing results from our community in June, although quite small because the number of cases through June were of course quite small, we do unfortunately know that we have Delta variant circulating. And this is exactly what we would expect based on what we're seeing from LA County and elsewhere. The LA County Public Health Department shared this data last week. And when we consider the region as a whole, one of the best data sources for our region really continues to be the Los Angeles County data. This graph confirms that, just as has happened throughout the world and the United States at large, Los Angeles County now certainly has the majority of their COVID-19 cases due to the Delta variant. So what is our community's condition? Well, over the last 4 weeks, the good news is our case counts day over day continue to be far smaller than what we experienced in the very difficult months of December, January, and February. But if we look here at the last 4 weeks and the number of cases reported every day to our public health department, we do unfortunately see a subtle incline or a subtle increase in cases reported to the health department every day. We know the Los Angeles County started to really show this last week and the week before, and their numbers are continuing to increase. And we know the state of California is reporting the same. And so as we follow this case count day over day and week over week, we anticipate that with Delta continuing to be very infectious and very prevalent, it's most likely that these case count numbers will unfortunately continue to tick up. So let's finish with some final thoughts. Since April, the Delta variant has quickly become the most common cause of COVID-19 worldwide and is now the most common cause of COVID-19 in the US, as well as in California and Los Angeles County. Delta is the most infectious variant yet seen in the COVID-19 pandemic. Whether it causes more or less severe disease is still being studied, but we have lots of reasons to believe it's very similar to the prior variants with regards to this. Vaccine effectiveness or vaccine efficacy figures are very hard to interpret because these reports are coming from very different countries and locations. Each are using different scientific approaches, and each population is of course very different, sometimes just slightly different. And so with all this in mind, I think it's more important to focus on trends than it is to focus on exact percentages. The US vaccines, that includes Pfizer and Moderna, and we learned last Thursday, Johnson & Johnson, continue to provide very good protection against the Delta variant and excellent protection from severe disease and hospitalization. The Delta variant is very likely to cause a surge in cases locally, and we may already be seeing that subtle increase. But that approaching Delta surge is going to look very different than any other prior surge. We have half of our community with good protection from vaccines. We know from our experience that we've seen in other communities that those who are unvaccinated unfortunately remain the most vulnerable to severe disease. But knowing what we know, seeing what we've seen in other populations, such as the United Kingdom, with comparable vaccine rates, we're hopeful that healthcare systems are less likely to be severely strained, even though they are unfortunately likely to be impacted by, again, inpatients admitted to the hospital and patients who are unwell asking for care in clinics. With that, I'll thank everyone for your attention, and please do get your vaccine.